Hi, everyone. My name is Dr. Jennifer Hobson. I'm the director of Physio Partners Renaissance Craniofacial Group, and I'm here to present on treatment for tinnitus. And I hope you enjoyed this session, and I hope if you have any questions, you can always email me at the end and make an appointment to see one of our craniofacial therapists. So here is the presentation. Okay. Can you see that?
Yes.
Okay, great. Wonderful. So treatment for tinnitus, this is a very, one of the most annoying diagnoses you will ever have in your life, ringing of the ear. So here's just a little bit about myself. I started the Hobson Institute, which was a center of head and neck breathing health due to a lack of focus in this area in the medical profession. I earned my doctorate at the University of St. Augustine in Florida. And I am, let me just make sure I'm recording. No, pause recording. We're good. And I am also a myofunctional therapist. So I'm not only a physical therapist for the head and neck, I am a myofunctional therapist, which is a therapist for the tongue and the swallow and the breathing, which is part of the TMJ. But not many PTs get into that field, but this is a clinic that also includes that. I'm also a Buteyko breathing instructor, and I'm trained in the Laney restorative breathing method. So if you all wanted to come in for any breathing treatment, tinnitus treatment, these are the therapists that can help you. Renuka Chilawar, Carl Warham, Kathy Matthias Riggs, and Kenneth Tsai. So I'm the director. I have taught all of my therapists how to do the hands-on treatment of the tinnitus treatment and also the myofunctional and the breathing techniques that we also include. These treatments are normally typically covered by medical insurance depending on your plan. So what are the treatments for tinnitus? So these are the treatments. So basically we want to create the proper posture. So we go through a postural re-education program. We also do manual therapy to your head and neck, TMJ, your jaw, your lower back if it needs to, your pelvis if it needs to be balanced. We also do dry needling. We're going to go into each of these treatments in just a little bit. Myofunctional therapy is also what I mentioned about the tongue and the placement of the tongue, the swallowing properly, and supporting the airway. Functional manual medicine is basically osteopathic manual medicine, which many of the osteopaths, the cranial osteopaths do. Kathy Matthias Riggs and I are trained in that. Kathy is certified in it. It's basically cranial work to the sutures. Nasal release technique is a technique that I do in the clinic that releases the cranium with a little finger cut or a balloon. Vestibular therapy is sometimes needed for dizziness with some patients with tinnitus, and also breathing retraining. So this is just a little bit about posture and how it affects the body. So we want to restore proper posture. If you see this alignment here, this is proper head and neck alignment. You'll notice that the 12-pound head that is loading the spine is positioned directly over the body. So the bones are stacked on top of each other. When this happens, the load of the head is only 12 pounds on the spine. Each inch you go forward, notice how this load increases. So you will find that every inch that goes forward, because of the lever arm, you're going to be straining your spine and your neck and your shoulders more and more as your head goes forward. Not only that, you'll notice that this position of the head and neck is a forward head posture. Not only that, it opens up the airway. This is just like the A and the ABCs of CPR, where you open up someone's airways. This patient is stuck in an airway posture to open up the throat airway space. This also will lead to a lot of joint compression. You'll notice that the spine is in a different shape than it is here. So you're loading these joints more. You're creating even more strain at the lower cervical spine, and it causes all these muscles to tense up, especially clenching of the jaw. Okay. So manual therapy, this is just an image of what it looks like. If we go in the mouth, we have gloves on. We want to do mobilization to the head and neck so that that curvature that you saw just a moment ago restores to a natural, normal lordotic curve. The more that does, the less strain you have on your head and neck, and the muscles are all being used properly. So we'll also do some soft tissue mobilization of the muscles of the head, neck, and face. We'll restore that proper curvature of the neck to reduce that tension. And one of the main treatments for the jaw away from the ear is to do distractions. The distractions, a lot of people clench right in this area. So you've got to think, if the jaw joint is right here and the ear is right there and they're clenching, they're going to create a compression right there at the level of the TMJ and the ear. So we'll go in the mouth and we will do what we call an axial distraction to create an unloading of that area, decompression of that zone. Now, for the dry needling treatment, now this treatment, if you've never had it, it's not the most pleasant treatment, that's for sure. It's a needle. So you're going to have a needle. It's a very thin needle. So it's a monofilament needle. It does not have a hole for any injectable. So it doesn't hurt as much as getting a shot. But you will find it a little tender. The muscles that we do, she's doing, this is Renuka right here. She's doing a dry needle to the medial and lateral pterygoid. Right now she's doing it to the lateral pterygoid, which is one of the muscles that's deep in the jaw that connects to that little cartilage that sometimes gets stuck in a bad position. So that anytime you do dry needling, it releases the tension of the muscle. It releases the muscle being tight, pulling on the connection of the muscle to the bones that it's connected to. So some of the muscles you'll see, this is from Janet Travell, who's a doctor that figured out what trigger points, where they referred to the body. So this is the deep masseter. This is a muscle that we all know clenches too much. When this has trigger points, guess where it refers? Right to the ear. So people have ear symptoms. So we always check that muscle. We also check the sternocleidomastoid. Why? Because that also refers to the ear. It connects to the mastoid process, which is right part of the temporal bone, and causes a ear sensation, sometimes fullness in the ear, sometimes ringing in the ear, sometimes pain in the ear. Other muscles that we commonly needle are the upper trap and the medial and the lateral pterygoid. These are the two that refer to the ear. These are the three that we see a lot, causing a lot of tension in the muscles in the head and neck. So myofunctional therapy, this is one area I will tell you not many people know. Some dentists know about myofunctional therapy, and it's a treatment for restoring proper relaxation in the face, nasal breathing, lip seal. A lot of people mouth breathe. They have their lips apart. They mouth breathe. Proper tongue posture. So what does that mean? Well, the tongue should be living in the roof of the mouth. Sometimes people have it very low, and those low positioned tongues cause people to clench. Correct swallowing patterns is another goal that we have for myofunctional therapy. Now, training the tongue to posture itself up on the roof of the mouth. This is what it looks like. This person is actually a little tongue-tied. That little cord you see there is a frenulum. So we'll check to see if there's any limitations in your ability to elevate your tongue to rest naturally and relaxed up on the roof of the mouth. So a couple exercises that we do is the clucking exercise, which is the cave. I'm going to stop share for a moment. So muscles in the mouth. So if I do a cave, it looks like this. So I'm just sucking and clucking. So to try to put your tongue in the end position And when you cluck, you realize, oh, that's where my tongue should be. It should be filling the entire oral cavity. Well, sometimes when it's low for years, some people have it for years, their tongues get very, very weak and a little bit thicker and wider and don't fit in their mouth. So one of the things we try to do is really tone the tongue. So one very good exercise for your airway and for toning is sticking your tongue out pointed. It's called a lizard. If I turn sideways, it looks straight out. And you notice I have no contact of my tongue on my teeth or my lips. So then you place your tongue on the roof of your mouth, put it right on the roof, and then draw a line all the way back to the uvula. So right on the end position, the spot, draw a line back and hold it, and you'll feel that your soft palate and the airway in the back of your throat will retract and open. Okay, so these are exercises that really help get your tongue to fit in your mouth and to rest properly. The low tongue posture patients all clench. Okay, so we want to make sure that we do not clench. This is a little bit of your throat anatomy. Your tongue should be resting right here at the N. If you say the letter N, should be resting right there. As you place your tongue in the back, entire roof of the mouth, this part is the soft palate. That part likes to fall. If it's not supported by the back of the tongue, if the tongue is down, this ends up falling. So we want to make sure that when you do the suck and cluck, the cave, it's not just the first third of the tongue or the second third. You want the entire blade to be gently sucked up and stretched so that cord gets nice and lengthened. So our jaws respond to collapsing airways by clenching. So just know that that's part of it. Now, this picture, you'll see, do you think that tongue fits in the mouth pretty well? Not really. So a lot of my tinnitus patients have this presentation where the tongue is just so big. If you look in your mouth, this is one airway score called the Mallampati score. This score is important for anesthesiologists to be able to intubate you. Well, this is now a common airway score to look to see how healthy someone's airway is. This one, just like this person, you can't see the back of their throat. You cannot see that hole. Class 1 is considered normal. You want to see under the uvula. You want to see that space where that airway is, that tube in the back of your throat. 2 and 3 are just gradually getting worse and worse, whereas 4, you cannot see it at all. Scalloping. People with tinnitus tend to have a scallop tongue. What does that mean? It's just the ridges of the tongue are imprinted by the teeth. And that's because the tongue just does not fit in the mouth well. So remember, the tongue should be placed up. We should tone our tongue. And even some patients go through some dental treatment to get their tongues to fit even better. So this is the ideal position of the tongue, all the way supporting the roof of the mouth, the back of the throat, and that soft palate that tends to drop, causing snoring and issues with clenching. This is not the right way. So this is just, you'll see a little bit of the tongue up, and this having that gap, that is not good. That will end up causing this to collapse. An airway collapse back there is just, you're not going to be sleeping well or breathing well throughout the day. This is another image looking from the back of you, the back of your face, in your mouth. This is a proper tongue posture. Your tongue should be starting at the bottom and elevating itself, filling that entire oral cavity. This is the position of the tongue that we want. We don't want any gaps here. This is basically sealed up there. Now, when the tongue goes down, you'll notice the size of the palate. That roof of the mouth is wider here than it is here. You see that? And the tongue goes down, it starts sitting on the lower teeth. That's not good. That tends to cause the tongue to fill the lower part of your mouth and fall into the airway. This won't be good for breathing and won't be good for jaw and facial tension. So clenching and grinding causes cranial compression. So this cranium that we have, the skull, it does not like when the jaw loads it from bottom up. Look what happens to the teeth. The teeth end up wearing down. You end up getting all kinds of dental work in the back molars. That's a sign that you've been a clencher for a long time. Airways get compromised. I told you that the airway is supported by the back of the tongue, right? So this is a healthy, normal airway size. This patient is a patient of mine that has had issues with clenching throughout the day and night, to the point where she's actually worn down one of her joints. One of the joints, the jawbone has a little pointy part so it's called the condyle, and it's flat on one side. Well, this patient, because of this limited airway space, is clenching all the time to try to tense up her throat to open up the space. Cranial osteopathy. Okay, so I'm going to stop share for a moment. Kathy Matias Riggs is our expert in cranial work, and I just want to show a video on how she describes what she does. Okay.
Or bruxism.
Hang on. There we go.
Tinnitus is often associated with compression of the skull and also dental grinding or bruxism. When someone grinds their teeth together, and often for hours at night or even during the day with clenching, you get compression of the mandible into the temporal bone, which then compresses the rest of the cranial bones around the temporal bone and even at the base of the head. So my methods that I use, cranial functional manual therapy, I use those methods to help decompress the skull, to get the cranial bones to move a little bit better and to be positioned better within the skull so that we have a better environment for all of your senses.
Wonderful. Okay, I'm going to stop share here. And I'm back to here. So this technique is very gentle. Okay, so we use this technique on babies that are, have plagiocephaly, when their skulls are a little flat on one side and fuller on the other side. So we just gently round the cranium. They're a lot more mobile than adults, that's for sure. But this theorizes on the cranial pressure can be influenced through techniques applied to the sutures. We found a lot of success on reducing compression in the skull and pressure around the ears with this technique. So clenching compresses the ears. Guess where the ear is? This is the meatus of the ear. This is the jawbone. This is what I said is the pointy part. So if this is loading and clenching all the time, all the soft tissues get irritated right at that level, which is basically the ear. Not only that, clenching tends to make that little cartilage that we have right above the TMJ condyle slip forward, and the condyle of the mandible goes even more posterior because it just slips in from behind that disc. What's posterior to the condyle is the ear, the meatus of the ear. So there's a lot of success with our therapy, along with some dental appliances that bring your jaw forward away from your ears. So there is a possibility for you to change your tinnitus if you try these techniques. And it's really one of those things that if you don't try, you don't know what you're missing. This is not a guaranteed thing, but we've been able to help many people with tinnitus. The osteopathic functional manual medicine can also address this chronic clenching problem we have. Nasal release technique. So this technique also decompresses the head. So some people, a lot of the patients that come in for this technique are more concussion type patients and TMJ clenchers, just to release the pressure that clenching loads in the cranium, that compression force. This you'll see in my hand is a little, it's like a little gauge that you pump Right in the nostril, we have a little balloon, what we call a finger cot. A lot of dentists use it, that just covers one finger. You create a little tourniquet at that level of the gauge, and you pump in the different nose meatises, and it expands and improves cranial bone mobility. Vestibular therapy. So we have Carl Warham does vestibular therapy, so does Kenneth Tsai and Lizzie Youthy in our practice. Some tinnitus patients need vestibular therapy, and it's a form of PT that it's basically, it uses specialized exercises that result in gaze and gait stabilization. So a lot of eye exercises, and most of the exercise involve head movements. And the head movements are essential for restoring and retraining this vestibular system. It also improves the inner ear function and balance. So the next treatment is the breathing retraining program. This is a picture of Dr. Buteyko, who was a medical doctor in Russia that figured out the more we breathe, the heavier we breathe, the sicker we are. So we are trained in this technique to restore nasal breathing, to restore diaphragmatic breathing. A lot of people mouth breathe, and improve the proper volume of breathing. So we all need to learn how to use our nose properly, how to breathe slowly, and how to breathe low using the diaphragm. This last pic, and actually this book is an excellent book if you ever wanted to read it. The breathing clinics that we offer at Renaissance, we basically use this book as a guide and a reference for our patients. But that book is a great book to learn about this program. The Lois Laney restorative breathing method is another method that we use to improve the cranial nerve function. Some of the cranial nerves that are involved in breathing and swallowing. If you've been breathing improperly for a long time, those nerves need to be reintegrated into the cranial nervous system. So that program, or that breathing training, really makes the brain work. Those automatic functions of the brain, like breathing and swallowing, they restore to normal. So we restore nose breathing. So many of us don't realize we mouth breathe. Mouth breathing will dry out our mouth. And a lot of people don't realize they're doing it, but if your lips are parted, you probably are mouth breathing. You will dry out your throat. The moisture will be driven out of the airway. This causes an inflammation of the airways. As the inflammation is there, it causes the airway to become even narrower. As the airway narrows, it creates a greater resistance to breathing, especially during sleep. So you do not want any more resistance to breathing. We need to open up our noses, make sure our mouths are closed, and breathe slow so that our airways do not collapse. Remember, very simple. We teach you how to keep your airway open, and this is how you keep your airway open. The heavy breathing will cause an instability in your airway, and it causes the airway to collapse. To help maintain an open airway, the muscles in the throat are designed to keep the airway open if you nose breathe, light breathe, slow breathe, and deep breathe. Deep breathe meaning using your diaphragm. So tinnitus is a pain, I will tell you. I know my patients that have gone through this program either are thrilled because it's reducing, or we've gotten it to completely eliminate, or it hasn't changed at all. So just know that it is a frustrating thing, and you will always be frustrated, but you don't know if this could help you unless you try it. Okay, it's coming up here.
Some months later.
That's not it. Sorry. Okay, here we go. I'm going to stop share so we change the screen. This is
And I just want to give you a little bit of my
George.
story and how I progressed and where I am now.
Glenn, sorry.
I developed tinnitus, which was a high-pitched kind of steam escaping sound. And I went to one doctor and he said, well, there's nothing you can do for it. Go home and get used to it. And then I went to a different doctor and they said, yes, there are things that we can do. And he referred, I met with Ken, the physical therapist, and we did manipulations on my jaw muscles and back of my neck. And we did dry needling. And that was very effective. It brought the tinnitus down to a level that was undetectable at some time. So I'm very happy with that outcome. For those of you who have tinnitus, you know how anxious it can make you feel. And so I don't really have that problem anymore with the anxiety. And then some months later, I developed a vertigo, which is a spinning when I would move my head. And I knew to come back here because I knew that they offered vestibular and vertigo rehabilitation. And I met with Lindsay, and we have been working on maneuvers, and my vertigo is clear now. Also, we've been working on balance and vestibular retraining, which is helping with balance. And I just feel overall much better. My tinnitus has gone down to the point, like I said, it's undetectable at some points. And the vertigo is gone, and I feel like I'm much better, much more stable at walking and balancing myself. So I highly recommend looking for every possible, treatment that you can.
All right, great. So, any questions?
I don't have any questions at this time.
Okay, thank you.
That was very helpful, though.
Yeah, well, I'm glad that you were here. I'm going to be recording this and sending it to any of the other people that are signed up for this course and may not have gotten the link. If you have any questions, you can call 312-986-9833, or you can email me, Jennifer Hobson at physiopartners.com. But I would suggest, if you want to try our program, call and make an appointment and see one of the Renaissance Craniofacial Group therapists at PhysioPartners. Thank you so much for your attention, and I hope to see you one day in the clinic. Take care.
Bye-bye. You're still recording.